What's the protein requirement I recommend for my patients? The recommended daily allowance for protein is 0.36 grams per pound of body weight. So that looks like somebody who's 100 pounds to eat 36 grams of protein. That's not enough. So that's enough to prevent deficiency of protein. It is not enough to maintain muscle and to keep muscle or to grow muscle. So my recommendations to my patients on a GLP-1 or in perimenopause or in menopause is 1 gram of protein per pound of lean mass. So sometimes we have to finagle that and figure out what we think that lean mass number is, or people can do a DEXA scan or do like a bod pod and figure out exactly what that is and shoot for that goal for protein. It is, if we do the math, what we find in the studies, it's usually about 0.9 grams of protein per pound of body weight, but I just say a gram per pound of lean body mass. Because you're not always going to hit it, and that way we can always sort of shoot for the stars. So that's somebody who's about 100 pounds, and then I recommend about 100 grams of protein a day. And I really highly recommend like tracking that, the amount of times I'll have people say that they are getting a high protein diet, and then I have them audit it. And I don't want to track food for too long, ever for very long, but I have them audit, their intake. And they're like, oh, I'm getting about 50 grams, or I'm getting, 75 grams. It's just not enough, especially when estrogen is falling, testosterone's falling, we're trying to change your body composition. We need that protein to help maintain that lean mass. And I am okay with supplementing at least once a day to get to those numbers. It can be hard to get all that protein in, especially for some of these populations. One protein shake a day, if it's high quality, doesn't have a lot of fillers, and it's a complete protein, I'm okay with that. This is a means to an end until we get to, where we want to be. But if you can't get all of that in, I'd rather you be using a protein shake just to get to that number so we do not lose lean mass. The risk of losing lean mass, becoming sarcopenic, is higher than a protein shake. So that's where I stand on that. And then I've said this before in another video, collagen doesn't count. So I hope this helps. This is not medical advice. Please talk to your provider about your protein intake, but this is what I talk to my patients about. And so this can help with a conversation with your doctor and decide what you might need.